Dr. Shark Holistic Health. This is our referral series. So one of the professionals that we commonly refer to is a biological dentist, and that is a specific certification that somebody who is already a licensed dentist will get. And so they go to dental school, get all of that, and then they get a bunch of additional training in biological dentistry. So we always recommend that if you're looking for a biological dentist, you go to the website, iabdm.org. That is the International Association of Biological Dentistry Medicine. They're the certifying body for biological dentists. It's not illegal for someone who's not certified by them to just write biological dentist on their webpage. So that's why we recommend checking every name out through that site, and that's a good place to find a dentist if you're looking. Why a biological dentist? Dentistry is very messed up. A lot of dentists are still putting toxic mercury in the mouth, despite the fact that the World Health Organization says that this is a terrible thing to do. It's very, very toxic and bad for your health. Of course, they say, oh, it doesn't matter because it's solid once it's in your tooth. Kind of true, right? So the problem is that every time you chew on that mercury filling, you're off-gassing. Another common practice in conventional dentistry is to put multiple metals in the mouth at the same time. So if you ever took a chemistry or physics class, maybe you remember that if you take two metals and an electrolyte, you get a battery, right? So this is how a potato clock works, where you can plug two different metals into two potatoes and run a clock, right? This is not a battery. So this is what happens in your mouth. You get a battery in your mouth because your saliva has electrolytes, and then you've got multiple metals. For example, you've got a post in there, and then a filling or a crown on top, or you've got one crown that's gold, and you got a mercury filling over here, right? So this is going to create electrical current, which can create problems, discomfort, pain, that then gets misdiagnosed as something like a dead nerve, and then you end up with a root canal, blah, blah, blah. So a biological dentist is going to do a much more thorough assessment of your mouth and your overall health. They should do a cone beam, which is basically like a CT scan of your mouth, so they can really see in more detail if there's hidden infections or problems in there. The best biological dentists will do live microscopy, where they actually scrape under your gums, put that on a slide, and look at what kind of bacteria are in your mouth, and then they'll determine what kinds of interventions to do with you based on how high risk your mouth profile is, right? They can also let you know about your risk for things like heart disease based on what's going on in your mouth. They can let you know whether you really need to fill a cavity or whether you can try to remineralize. They can let you know whether you really need to pull a tooth or whether you can wait it out. How much of an emergency is the dental work they're recommending, right? Or can you put it off for 6 months until your health is a little bit better? So those are the reasons that we like to send people to real certified biological dentists.